Hi, Dr. Gerard here, and I want to talk today a little bit about esophageal reflux and heartburn, GERD, hiatal hernias. Those are all kind of in the same category, and they have to do with indigestion, burning that refluxes back up from the stomach into the esophagus. So here's what happens. Your food comes down your esophagus, and then it goes into the stomach, and then there's a valve, the esophageal sphincter, that closes. And then the stomach is filled with food, and you begin to secrete hydrochloric acid and pepsin. And then once you have reached the proper amount of acidity, because it's very acid in there to break down food, especially proteins. So when your stomach reaches the proper acidity, the second valve, the pyloric sphincter, will open and your stomach will dump its contents into the small bowel. Now, sometimes we don't have enough stomach acid. Notice I said we do not have enough stomach acid. So the food bolus sits in there and it begins to sort of putrefy. So it's not healthy. The enzymes haven't done their job at killing off any bacteria. And so the body tries to reject it. It says, get this out of me. And so where's the quickest way out? Up. So many people have esophageal regurgitation or indigestion, and they think that they need stomach antacids to reduce the acid because they have acid up in their esophagus. In reality, they often need to have actually extra enzymes. And so that's one thing that can happen. So too little stomach acid can be a problem. The next thing is, if your stomach doesn't work properly all of a sudden, why isn't it working right? So the first thing that I talk about is, how is the nerve flow to that area? If you get up in the morning and your toaster doesn't work well, I don't think you're going to throw it in the trash and buy a new one. You're going to make sure that you're getting power from the wall. And so the nerve supply to the stomach comes from right here, this lower mid-thoracic area, T6 in particular. So the first thing I'll do is check the spine. So many cases, I would say over 80% of the cases of indigestion respond to adjustments in this thoracic area of the spine. Now, some people have a problem with the valve. The valve itself isn't shutting properly, and that's called a hiatal hernia. And so there's a hole where the esophagus comes through the diaphragm, and that valve is right there. So sometimes that valve can push up or herniate into the esophagus. And so you don't always need surgery. In fact, the majority of people that I've seen have responded really well and have been able to correct their hiatal hernia simply with an adjustment to pull the stomach down and pull that valve down to where it can close properly. So I'm going to demonstrate this adjustment on one of our patients. This is Sherry Lepley. She is an awesome lifestyle coach, wellness coach, and nutrition expert. And so she's agreed to let me do this maneuver on her, this adjustment. So she's at Castle Hill. This is Jamie's mom. Let me have you bend your knees up for me. So here are the diaphragm. The esophagus comes down like so, and then here's the stomach. And so Sherry doesn't have this condition, but I want to go ahead and show you the maneuver, how I do it. And so I have her taking a deep breath, and then she lets it out. I place deep pressure and then traction down, and then it's a tug maneuver. And then a deep breath again, and then let it out and pull it down. I'm not doing it quite as hard as I would normally do. It can be a little uncomfortable, but it's not bad, especially compared to the distress of a hiatal hernia. So I just wanted to share that with you. If you have questions about that, let us know. We can happily answer questions. And for many people, they need to eat better. They're eating very rich or heavy, spicy foods, large meals late at night, and this is contributing toward this esophageal reflux. So clean up your diet, and that might help you a lot. Have a great day.